Good afternoon, everyone, and welcome to our webinar, Procedural Timeout. I am pleased to introduce my co-host, Ms.Rahaf Alhamar, an angiography staff nurse with strong hands-on experience in procedural safety and team coordination in angiography setting. Ms. Rahaf plays a key role in supporting safe workflow, clear communication, and consistent timeout practice before, during, and after procedure. Ms. Rahaf, thank you for joining us today. We are glad
Thank
to
you.
have you with us.
Thank you so much. Good evening, everyone. Assalamu alaikum. Thank you all for joining me today in today's small short session. Hopefully it will be beneficial and informative, inshallah. First, I would like to introduce myself. I am Rahaf Alhamar. I'm an angiography nurse. And today I'm going to talk about the timeout principle. Of course, this is not a new subject to most of us, if it's not all of us. But let's take this opportunity to refresh our knowledge and informations. First, we will talk about the definition of timeout. Why are we doing the timeout? When and who is involved? Steps of timeout, communication, consequences, and documentation. So we will start with the question of what is timeout? So timeout is a safety pause to be taken by the team before starting the procedure in order to confirm several safety essential steps and checks are undertaken. It's a mandatory safety pause before initiating any procedure, just to ensure that the correct patient, correct procedure, and correct site, and minimize patient's error. So what is the purpose of timeout? To prevent any error in any type. For example, wrong patient, wrong procedure, wrong site procedures, by improving team communication and teamwork, and to assure the availability of all relevant documents, implants, and equipments and supplies, and to prevent the delay and cancellation of procedure. So when is timeout is done? Of course, timeout is a mandatory step, so it should be done before initiating the procedure itself, immediately before the procedure starts, after the patient is prepped and draped, and when the entire team is present and attentive. Who participates in the timeout? So all teams should be involved and active during the timeout. This includes the surgeon, physician performing the procedure itself, nursing staff, anesthesia team if they're applied, technicians involved. So timeout steps maps. So first we will start with introducing the team members. This includes the surgeon or the physician performing the procedure, anesthesia team nurses and technicians. Confirm the patient identity. This includes verifying the patient's full name, MRN, and the date of birth. Confirm the procedure name. This includes the reason of procedure. Confirm the side marking if it's applied. Confirms the consent from availability. This includes the procedural consent, anesthesia consent if it's applied, and childbearing consent. Review the allergies, review imaging, labs, precautions, and any abnormalities if it occurs. Confirm equipment and implants, and discuss the critical steps and concerns. Next, we have the team communication. So when the timeout is performed, all other activities should be suspended. If it's not necessarily could affect the patient's safety, it should be suspended, and all the team must be attentive and active participant during the timeout and during the patient's verification process. The assisting nurse announces the timeout. It should be loudly and in clear terms, politely, not in a shouting manners, but enough for the entire team for them to be heard and in a clear terms. All staff involved are encouraged and supported to speak up and express concerns if it occurs to enhance the patient's safety. Next, we have the consequences of skipping the timeout. So timeout is a mandatory step to enhance our patient's safety. So it's very risky to skip the timeout. This might lead to consequences such as the wrong patient, wrong procedure or site errors, legal risks, and compromising the patient's safety and delays. Documentation. Finally, timeout must be documented in the patient electronic medical record through e-Sahhi, signature of the nurse and the physician performing the procedure, document responsible staff and all staffs involved, time and date, and note any issues and corrections. So finally, as a summary, timeout is a vital safety step, is a mandatory, very important step before initiating any procedure for the patient. It protects the patient and the healthcare providers. It ensures the accuracy and communication within the team members. A small pause that prevents major errors, and timeout will be documented through e-Sahhi system, including the team members involved. So finally, thank you all for joining me in today's short session. I hope it was beneficial for all of us and informative. I would be more than glad to answer anyone's questions if anyone has any. Thank you so much.
Thank you so much, Ms. Rahaf. الله يعطيك العافية.
الله يعافيك.
الله يعطيك العافية أستاذ رهف، وصراحة تشرفنا بوجودك معنا. الله يعطيك العافية.
الله يعافيكم يا رب. شكرا
جميعا على حضوركم. الله يعطيكم العافية جميعا. شكرا.
شكرا.